can be manipulated on that standpoint. So, but education is a lot like healthcare. And so, kind of fast forwarding through my history, we saw just rampant imperfections in the healthcare world. Mm-hmm. Not just from how, and this is 2014, 2015, not just how healthcare was delivered, but how it was really paid for.
Yeah.
And so what drives me nuts, Will, is being in this industry for like 8 years, and I'm like, I can't stand it when somebody says, oh, well, studies have shown that, the United States spends all this money on healthcare, but yet we have, one of the worst outcomes out there in the world. And I'm just like, that is such bullshit. Yes, we do spend a lot of it on paper. A lot of it's funny money from a hospital and insurance standpoint. Like, you actually never know what dollars are being exchanged. Mm-hmm. But every single person that says that to me, I say, well, great. So you tell me, if you get sick or you need an operation, where are you going to go? What country would you rather go to have that operation, that life-saving operation?
Well, there's no other place you'd rather
There's
go than
no
the
other
United
place.
States.
That's why people come here.
Mm-hmm.
I go, okay, so we've established that we have the absolute best healthcare professionals in the entire world, in the history of the human existence, right? We have the best ones. So now, what is the gap? What's missing? Now that we established that we have the best people, but yet all these problems exist over here, what's the natural conclusion? And to a T, they say, well, I never thought about it, though. Is it just the business of healthcare? How it's paid for, how it's bought and paid for is so opaque and confusing that capitalism cannot function there. Mm-hmm. And so we have a massive intrusion of government. Same with education, right? Mm-hmm. And then that creates complexities, that creates layers, that creates bureaucracies, that creates red tape, that creates barriers, roadblocks to getting an actual plan or treatment, actually getting healed, and then paying for that. Just like you would for, go to a baseball game and buy a hot dog. There's a price up there. Yep, I want that hot dog. I don't want popcorn. I'm not going to pay for the popcorn. But in healthcare, we just don't have educated consumers. Right? If I'm selling you dish detergent, I'm going to do everything I can to make sure that my dish detergent is the best.
Right.
And you see it in commercials. This will get your whites whiter. It'll keep your colors fresher. This will work with cold water, so you actually get to save money. Like, you walk into the dish detergent or the laundry detergent aisle, I guess I kind of went to laundry detergent there, knowing that, okay, I know this brand says this. This brand over here says this. I understand what's going on. I'm gonna pick the one that fits my budget and fits my needs.
Yeah.
You cannot do that, or it's very, very hard. You actually can't do that. It's very, very hard for a healthcare consumer to do that. Right. We default to emergency care. Every single health insurance plan written out there defaults to emergency care, which has like a less than 1% chance of happening to any American per year.
Why do we default to emergency care? Is it just because that's what we think everything's an emergency, or is it just what we know? Fear.
What if I get sick? What if this is the year that I get diagnosed with cancer? What if this is the year I get in a really bad car accident? Mm-hmm. Well, most of us live our entire lives. Vast majority of us never have that happen to us.
Right.
Thank God.
But we live in fear that it will.
And so every single insurance plan is built for that purpose. That's why it's so expensive. Amongst other political things that happened 10 years ago, but I don't really want to get into the ACA and that kind of stuff.
Another conversation.
Well, yeah, and so people have this mindset also of talk about lack of education when it comes to healthcare, that I need to have health insurance to even talk to a doctor or see a doctor. And we're like, that's complete BS too.
Yeah.
Most doctors would rather have you walk in, say, how much to treat this? Right, here's $100, here's $50, I'll write you a check, here's my credit card. It is so much easier. Most doctors' offices right now have an overhead ratio, an expense ratio of like 70%, which means that they pay, whatever revenue comes in, they're paying about 70% of that to actually staff their office and do a lot of things that don't require a medical professional. So like each doctor needs like 5 to 6 support staff.
Okay.
Which is insane. Which is why a lot of the costs go up there, because you have so many compliance costs coming in that the prices need to reflect that, so that physicians who remain the most empathetic, smartest people in our society, by and large, There's not a lot of people out there that can be doctors who are smart enough to do it or dedicated enough to their fellow human being who actually want to go out and, take the wart off your bottom of your foot or actually care, if you're sick. There's just not that many of them out there. Yeah. That's why it pays well. And so, if we look at the actual business of medicine, that's what drove us to create, ask these questions of, is cash pay medicine, is this a thing? Can I go actually walk into a doctor's office and pay cash? The answer is yes. You're going to get a lot of funny looks. But that's kind of how we got into Freedom HealthWorks. It was saying, you know what? Let's make it easier. Let's make it simpler. Yeah. Let's go back to the days where, Norman Rockwell was drawing and making pictures of the old town doctor making house calls and, putting a stethoscope on the little doll's heart without sending the doll the goddamn insurance bill later on, 6 months later, that elevates it to a level 4 code and has all these other things on here that you and I just don't understand. Yeah. Not many people do. And so we don't ask questions because we don't look like idiots. Right. So I think...
or we don't know what questions to ask.
Or we don't know what questions to ask. And that's a great, kind of lead into what I was saying, because a lot of people will say, oh my gosh, Chris, there's so many things that you talk about that resonate, and I don't know what I can do. What can I do as an individual patient? And I tell everybody, like, every single person in this country can make a difference in healthcare by walking into their doctor and just asking how much it's going to cost. If you walk into a doctor and says, "Hey, I want you to go get your elbow checked out, or if you got some soreness in your knee, here's some meds, here's some imaging, whatever it is," and you say, "Great, how much is all this going to cost me?" I'm going to bet 99.9% chance the doctor's going to say, "Well, I don't know." And they get let out. They get let off. Be like, "Oh, okay, yeah, you know what? You probably wouldn't know. Like, you're the doctor. You're trying to best, take the best care out of me." He's like, "Say, go ask somebody up front." But I guarantee you, if that doctor then walks in that next appointment, and it's somebody with strep throat or something, and they say, "Hey, I'm going to write you a prescription. What's your pharmacy?" And you say, "Well, tell me what it's going to cost, whether I go to a local pharmacy versus a big brand." You have that conversation enough. And that doctor doesn't want to look like an idiot, because doctors are historically the people that need the answer in the exam room, because people are facing pretty serious, you have some pretty tough conversations right now, and you have to have the answer. They don't want to look like morons. Right. There's some pride. There's a lot of pride in medicine.
Ego a little bit too.
And so if everybody starts asking what the price is, you better believe that they're going to figure out a ballpark of what is going on. Right. And they're going to look and say, you know what, maybe the people that I've been referring to for specialty care, maybe that's not the best option. Maybe there's some other options over here. So just get that ball rolling. Yeah. And I think that's what every individual can actually do to help make an impact on a small local level to help drive something forward.
Just ask questions.
Just ask questions. Never go to a hospital alone. And if you do, just ask questions. Just engage in conversation. Keep that doctor in there as long as you can. Make them actually look you in the eye.
Get your money's worth out of them.
Acknowledge that you're a patient.
Yeah, because usually they're in there, 5 minutes, and then on to the next one.
They don't know who you are. You're facing a merry-go-round of physicians and nurses.
I think that's a major issue, too, is the doctor never really gets a chance to know their patient. And they can't, because they have to fill a quota, too, don't they?
Yes. Yep. We treat hospitals like assembly lines. Yeah. And that's the business of medicine, right? Yeah. That's how it is reimbursed, and that's how we pay for it, which I fundamentally have a problem with. And that's why we, started Freedom HealthWorks, to help physicians get out of that, because no doctor's happy in that. Right. They didn't come here to start, treat people like widgets and see 40 people a day. Right. That's miserable. These are people who are deeply empathetic. Yeah. And crave that relationship.
Most of the time, they get in it to do well by their people.
Yeah. Yeah. You talk to a physician about a doctor-patient relationship and how alive and well that is today, and they'd laugh and they'd say, that's a relic. That's a bygone era.
Yeah. They want to do good, and then it turns into just becoming
because they're forced to do that. Yeah. They're pushed that way by the costs of the administration that they have to support. Yeah. You think about a hospital, and a hospital is just a collection of specialists. I think it'd be curious if we could ever move towards independent practice for doctors, and we have hospitals for trauma, for the actual emergencies. Yeah. But then you get in the conversation of like, well, too many people use ERs like urgent care, and too many doctor's offices, or especially if you're employed physician, you call after hours. You're not going to talk to the doctor and the nursing staff or whoever they'll call. Be like, well, we should probably go to the emergency room, and it's all CYA, so it's all like litigation, and you bring attorneys into it. And it's just like, oh my gosh, you start spiraling downwards. The more and more you find out about it. Yeah. So it is confusing. It is complex. Most people don't care. Most people just want to look at their insurance and be like, oh, this is what I get. And then when I come along and say, hey, for $85 or $90 or $99 a month, you could have a doctor, your doctor, on speed dial. You can call them whenever the kids are sick, whenever you're sick, whenever you have a question about something, or a prescription refill, whatever it is. Maybe just somebody to talk to. And I love it when they're like, well, I already pay for insurance. Why should I need that? I don't use it. I only go once a year. And I laugh and I'm like, would you rather pay $100 a month for something you don't use that is there if you need it? Or are you really happy continuing to shell out $4,000 a month for your insurance plan that you also don't use? Mm-hmm. And they're like, oh.
Which, also you have to fill or pay the deductible of as well. Well, yeah. Which a lot of times is $8,000 to $15,000.
Well, it's a lot of time it's like older men, middle-aged men who say, "Well, I just go once a year to get my free preventive visit." I go, "Great.
Prostate check.
Do you pay for health insurance?" Well, yeah. No, well, you don't view that as being wasted. You could flush anywhere from $2,000 to $4,000 a month down the drain for something you don't use. Yeah. But yet you're telling me that you're going to waste money by paying for an actual service from a physician that is reliable.
Well, and that this used to be an issue from a tax perspective as well. You used to not be, or you had to have healthcare benefits, otherwise you were paying
Yeah, but I don't.
That's not.
I've never heard of anybody who actually got tagged by that, because there's a lot of things. It's like if your premiums run to a certain level of your income versus a poverty line, like then you would be subject to the tax. Like not very many people are even.
Well, and that's gone now. You don't pay a tax.
It wasn't even that much, right?
Yeah, it was like $500 a year, so it wasn't huge. But there is no tax penalty now.
Right. And to be clear, like I think insurance, if it functions as insurance, like Legacy is in the insurance business, but that makes sense because it is risk adjusted financial tool. That's what insurance is. It is so a tree falls on my house, I don't go bankrupt trying to rebuild and get my stuff back, right? Like it is things that it's an affordable premium for auto and home life if people do that kind of thing. But health insurance functions as prepaid. I'm going to pay an egregious amount of money right now so that if something happens in the future, I get the privilege of actually paying more money to use my insurance.
Do you know the statistic of how many people actually end up utilizing or I guess getting their full money's worth out of their health insurance?
It's low because there's people with diseases, rare diseases, that will meet it every single year. Yeah. And I'm like, okay, thank God there's insurance, right? That's what it should function as.
That's where it should function.